So welcome to this mock exam. See, a very good job to organize this and actually simulate as far as possible exam conditions, heading into the actual rooms that the exam is going to be held. I think it's going to be so similar to the real exam situation as this practice round. That's a very good opportunity for you to familiarize, sensitize yourself to the stress of the exams. For your level, for the part 1 level, we are going to focus mainly on assessment. That means diagnosis, assessment of risk, and taking a history, and those things we will be emphasizing on. Communication skills is all about, philosophy is all about communication skills. So you want to observe how you communicate with the patient. And you don't just jump in and just talk to the patient without introducing yourself. So introduce yourself, who you are, explain the tasks that you're going to perform with the patient, and ask for permission to carry on. So the acronyms IEA, I am an expert, IEP, I am an expert psychiatrist. Introduce yourself, explain your task, ask for permission to carry on. IEP. And then you can launch into your task. The task may be to assess the person, take a history, or explain something to the patient. And then you know you have only 7 minutes. We give you 2 minutes to read the vignette. And this will be done outside of the room. 2 minutes to read. And then you can scribble whatever notes you want to make on a clipboard, which will remain with you for the whole duration of your scheme. There will be 6 stations, part 1, 6 stations for part 2. So bring the clipboard along. Don't worry about the vignette, because the vignette will also be repeated inside the room with another copy of vignette. So don't bring it along with you. Don't bring the vignette along, okay? Because that belongs to the room. Don't take anything out of the room. Just bring the clipboard with you. 2 minutes before the end of time, there will be a signal. Signal could be a knock or something like that. 2 minutes before the end of time, and then at the end of time there will be a long bell. So once you hear the bell, you have to leave the room and go to the next station. The examining staff will be ushering you to the next room. So don't worry, there will be a traffic marshal to tell you where is the next room is. Actually, during the stress of the moment, you might even go to the wrong room, but don't worry, somebody will direct you where to go. Usually we don't want you to read before everybody is all ready to start reading. That means nobody will have an unfair advantage. So when you go to the station, the vignette will be face down. And when the signal is given, then you can open it, then you can start reading. 2 minutes read, during which time you can make notes, jot down some things, important points, and then you can, when the bell sounds, you can enter the room. That's about it really. Any questions?
We were told that we get 1 minute lead time and a bell 1 minute before the end. Is it 1 or 2 minutes?
I think it's 2 minutes.
I thought it was 1. So if the chief examiner says it's 2 minutes, we'll shift it to 2 minutes. But to be honest, 2 minutes each then. 2 minutes.
So we get 2 minute warning, like 5 minute warning. 2 minutes.
2 minutes to read. 2 minutes to read.
But then you said we get a warning bell.
1 minute before
the end.
Correct.
Sorry, 1 minute before the end. I mean, 42 minutes before the end. 1 minute before the end. If you haven't finished, you just have to go in the room. No, you can't carry on in the room. So if you know there's 1 minute left, there's no point asking any questions. Time to wrap up. We give you marks for introduction, give you marks for the task you have to perform. We also give you marks for the ending and how to wrap everything up, how to conclude everything. So during conclusion time, don't ask any questions. So the actors, you have simulated actors. They will be coached, they'll be primed how to answer the questions. So if you ask appropriate questions, the answers will be very forthcoming. Obviously, if you ask questions for which the actor himself has not been prepared for, he won't know how to answer. So you notice that they will be quite reticent. say, I'm not sure. Then you know that you're on the wrong track, and don't keep on trying to extract answer from the actor when no answer is forthcoming. Better go on to the next point. So ask open-ended questions. We are testing you for your interviewing skills. Don't keep on asking leading questions. Ask open-ended questions. You get a very good, create a good impression if you can ask open-ended questions. Paraphrase. Give emphatic statements. Summarize. Ask normalizing statements. So we want to see whether you can perform all these tasks. One question. So all the best with your practice. Hope you can all get through the exam. And we'll see you in April, right, this year. Okay, all the best.